Welcome back. From children to more mature adult orthopedic care can be beneficial. And joining us now is Dr. Scott McGinley. He is part of the team at the Jacksonville Orthopaedic Institute. Dr. McGinley, it's good to see you. Thanks for being here.
Thanks for having us.
So you're located over in Fleming Island. That's where you primarily see your patients. And what kind of patients do you see typically? Anything from adults all the way up to or down to children?
Yes, enjoy children and 99-year-old people. Just got invited to a 100th birthday party last week.
And so let's talk about your specialty. Do you have any specialty when it comes to orthopedics?
I was fellowship trained 20 years ago in sports medicine at the University of Florida. Sorry they lost this weekend, but we were pulling for them.
We watched. It was a little bit of rivalry in our household. So let's talk a little bit about primarily your older patients. And one of the things I'm sure they come and see you a lot about, and that is arthritis. So first of all, let's talk about arthritis, and then let's get into how you best treat your patients.
Yeah, everybody thinks arthritis is an old person's disease, but there's a juvenile form as well. So we'll treat all the way through up to 90 or 100-year-old. Most of the time it's medicines and injections. People get scared when they hear the surgery word,
Sure.
So I treat most people without surgery.
First, how do you diagnose arthritis, and what are some of the symptoms that somebody might be experiencing now that indicates they need to come see you?
Morning stiffness, pain going up and down stairs, kneeling, walking, requiring medications.
And when they come in, how do you diagnose this, and then what are some of the typical treatment options? You say surgery. Is surgery something that could alleviate the pain considerably?
Yeah, it's a last option though. We want to try conservative treatments first, and then surgical, like a knee replacement or hip replacement, which I do and my partners do as well, is something that is very helpful and beneficial.
And do you see a lot of your patients being able to get their life back, if you will, after having maybe some of these joint replacements that alleviates them from this pain of arthritis, which can be debilitating?
Yes, well, it's an ongoing process. We can't cure arthritis, but we can treat it, so we do the best we can.
Okay, and what did you say the first thing that people need to do is come and start the process of getting treatment? It's not going to get better on its own, I'm sure, and taking over-the-counter medication sometimes is not great for you and not going to result in anything long-term beneficial.
Sure, there's a lot of the side effects to even the anti-inflammatories, and there's a lot of things out on the market that really aren't proven, so I will discuss those things with them as well.
Okay, all right, let's talk a little bit about the kids, because one of the things that we see is they're either getting out over the holidays and playing, or maybe when they get back into the school year next year and they're getting involved in sports, are fractures. Talk about your pediatrics that you do with kids and what that is like in your
I enjoy taking care of children. I just always have, from being a camp counselor and having 4 kids of my own. So I enjoy taking care of children, from the waterproof casts to the colored casts. Everyday fractures are simple, and if they need surgery, I enjoy doing that as well.
Yeah.
But
you see a lot of patients, I'm sure, coming into your practice, sports related
yes.
and what have you.
And my partner, Dr. Sparks, loves to take care of children as well. So we'll take care of babies with fractures if we have to. And that's sad, but I enjoy taking care of them as well.
Is there anything preventative? I know things just happen and kids go out and play and they hurt themselves and they're involved in sports, but is there anything preventative that parents can do by coming and seeing someone such as yourself, maybe perhaps get a good baseline about how best to take care of their kids?
Sure, I have repeat offenders who come in all the time and we have to sit down
I was
and
one
talk
of those
about
growing up.
Were you?
Yeah.
Yeah, I can't walk and chew gum at the same
cannot
time.
do it, yep.
You put them in ballet to try to get them to have coordination. Doesn't work. So a lot of times it's just basic, common sense stuff, or preparing them for, stretching before a meet that they never thought of doing, or getting them in a different sport or orthotic or different type of shoe.
Orthotics, I'm sure, is a big thing preventative-wise to make sure that, having suffered from stress fractures myself over the years running track and cross country, that made a big difference.
Exactly.
All right, so let's talk about one of the procedures that parents probably have for their kids and perhaps themselves is something called knee scoping, or getting your knee scoped. What does that mean?
Yes, well, even young or even old people, 10 I think is the youngest I've ever done. 95 is the oldest lady I ever did. You can scope a knee and take care of meniscal tears or debride the arthritis or the synovium. It's a good way to get a knee as good as it can be, and then therapy afterwards, weight loss, anti-inflammatories, and that seems to help people quite a bit in my experience.
If someone is experiencing any sort of pain in a joint, let's say it's a knee, whether it's a child all the way up to an adult, recommend coming in to see you? What can they expect when they walk in the office in Fleming Island?
We have a brand new office opening up in 10 days, right next to the emergency room there on Village Square Road. And we have x-rays right there, an MRI right next door, and same-day appointments, especially for children who are injured. My old saying is, children don't wait, so you don't even have to call, just come in, we'll work you in.
Okay.
So.
All right, Dr. McGinley, thank you so much
Thank you
for
so
being
much,
here. We
Casey.
appreciate you, and happy holidays, and we'd like to thank Jacksonville Orthopaedic Institute for coming on and sponsoring this segment. And you can get more information on their facility and practice by logging on to joi.net, or you can call JOI 2000, the number there on your screen.